Mr. Villa, it is 1 year since the first reported case of COVID-19 in the world. What we have learned for now for this coronavirus?
Yes, it is 1 year anniversary since the emergence of this virus globally. And what we are seeing now is that it threatens more and more the lives of millions of people. And I just want to bring to your attention that only in the past 4 weeks, we have seen more cases have been reported to WHO than in the first 6 months of this disease. So we are still full in it. And what we know is that across Europe, hospitals and IC units are really full with patients and or are filling up.
You know that it's exactly the same situation in Macedonia now. The situation is critical. What is the support that the healthcare system in Macedonia is taking from the WHO?
It is a continuous work since even before the start of the infection in the country. So what we have done a preparatory time where we prepared the labs. When we heard about China's first experience in this virus, so the labs were prepared to start testing, and the country has started testing very early in the process. Very early in the process, before appearance of cases. We have seen also that the North Macedonia has taken the guidelines of WHO to close the long-term care. For example, for elderly, they were very well protected, and we have not seen big epidemics in those special settings where you have vulnerable groups. We have delivered about 1.8 million United States, US dollars in worth of personal protective equipment for the health facilities, either for the labs or for the facilities who are treating COVID. We have also provided continuously testing material, supplies for testing for the labs. We have also brought to the country virtually or even physically 20 missions to help in different areas.
But in practice, we see that the cases are going up and the hospitals are almost full with patients. What do you think that should be the next step of the government? Do we need to make a curfew or to close the schools?
Let me tell you one thing. Let me start by the schools first. I would just want to tell you that children have less risk from severe COVID disease. However, children have really suffered from the pandemic in many ways. School closure have a clear negative impact on the child health and education, development, the family income, and the overall economy. And we have the proofs for this. So we really need to allow the students and the children mainly to continue the studies and try to get to the next level. And this is very important for their social development and psychological well-being, and for the well-being of their parents, because if they're not in the school, parents cannot also continue their daily activities. I can tell you that it is very easy to introduce a curfew, but it is very difficult to get out of the curfew. So there should be a balance between what are the gains and what are the benefits from one side, and on the other side, think what would be the damage or the problems, the challenges with such a situation. What we have done, we have put some threshold in order to help the country to think and to analyze all the time at what level they are. I can tell you that the country now is at a serious situation, but it is not in the red in terms of the numbers, but we are at a hospitalization phase. That means all our efforts should come to support the health system in order to stand and help to continue to give care for COVID and other than COVID patients. We need to help to decrease the flow of patients and decrease the severe cases. We need to protect our vulnerable group, mainly the elderly, those who have hypertension, diabetes, and other chronic diseases. So what we need is to make sure that they are protected and they are not exposed. And
do you think that these groups should stay at home?
This group should use the 3 methods that I have told you mandatory and all the time. If I go out in the open air, but I have my mask and I try not to touch anything and I clean my hand all the time, I don't shake hands, I don't bump hands also, you should only, don't touch but with your elbow. And if you keep the mask and these measures, distancing, you will not be at risk. It is not possible for the COVID to travel very far. But if you go to closed settings in restaurants, bars, or other places, closed places, and in a crowded place, this should be totally avoided. I would prefer that the elderly keep distance. I cannot tell you they should stay at home. Each one has his own situation and conditions of living. But I can tell you that it's better that children do not come and visit. There is no mingling too much, and they don't go to crowded places, and they protect themselves. They take their usual medications. If this continues to increase, definitely we will come to a red situation, to a big emergency situation. Now the government has called it a crisis. So they can control and mobilize everybody to respond. So there should be mobilization to improve and to increase the beds and the ICUs to support the patients. And all this is to decrease the mortality risk, the case fatality, and also to decrease people getting infected. The main responsibility is on the individual. I'm not saying it's because we are mingling and going and it's our fault. In this situation now, we have to postpone going to crowds, postpone doing big ceremonies, postpone coming together in big families in order to reduce the need for healthcare. Because if you need healthcare and there is no bed that can be provided, you are at risk of many things, of complications, of death. And it's not rocket science. It's 3 simple issues that can be done: the masks, the physical distancing, and also keeping the hands clean, washed. If you touch something, always wash your hands.
Yeah, but everyone is expecting the vaccines for the COVID-19. What we have what do we know for now? Like there are a lot of positive informations from some companies, but when we can expect to have these vaccines in the healthcare systems? And what about Macedonia? Are we going to get some vaccines from the WHO?
Yes, WHO has worked very hard to make sure that the vaccines are considered as a public good, something that can be available to all countries in the world. So what we have done, we worked with manufacturers and we worked with companies, with countries and everybody to get a platform that we call the COVAX facility in order through this platform to make sure that there is an equitable distribution of the vaccine and that the wealthy countries are not stocking the vaccines while the less wealthy countries cannot get the vaccine. So through this platform, North Macedonia has applied and also signed the contract with Gavi in order to make sure that at least 20% of the population will receive the vaccine. Now, mind you, we don't know what type of vaccine will be available. So there are now 2 prominent important vaccines, but there are 10 other vaccines that are in the clinical trial 3. That means they are trying them on human beings to see their safety and efficacy.
We are all expecting to see the solution from the science, but what are your expectations when we can get back to the normal life?
First of all, you have to understand that not everybody, when the vaccine is available, and even in the country, not everybody will receive the vaccine. It will be given to most vulnerable groups. That means it will be given probably to elderly and healthcare workers and other forefront workers, for example, social workers, whoever is in contact with the virus. So it's not going to be something for everybody. We need first to protect those who are vulnerable because the aim of the vaccine is to decrease mortality and decrease the number of severe cases who are in the hospitals. Probably we need to be ready to receive the vaccine either by next March, first quarter of next year, 2021, or mid quarter of next year, 2021.
Yeah, but just for the end, we have seen that everything can happen in a few months. So you said that we can expect the vaccine in March. What you can say for the people in Macedonia? There's been a lot of fake news in the public. We have heard that WHO is giving money for every reported case of every country in the world. A lot of rumors in the public. What is your advice for the people in the country?
I have to say, this is a strange question, but let me tell you, I have to say that WHO success is when we stop and control this epidemic. It's nonsense to say that we are paying money in order to increase the number of cases. We have no gain in that. So whoever is saying this is really not informed very well about the situation. We have made a study about what people believe in North Macedonia, and we have seen that most of them believe the right information. Only a very little number of people go after the rumors and the fake news. We need to direct our frustration not against the instructions or against Ministry of Health or the government or WHO. We need really to direct our frustration against the virus itself and be strong to overcome this virus by using very simple methods. We really need to follow those instructions, wear the mask as we can, keep our distance. These are three basic measures and easy to apply.
Ms. Stavila, thank you very much for this interview and for this information.
Thank you anytime. Thank you very much. Take care.